Hey everyone, welcome back. Are you ready for this? We're going to take a deep dive into something pretty interesting today.
Yeah, this should be a good one.
It is. It's fasting and kidney stones.
Uh-oh.
Yeah, right?
Big topic.
It's a big one, and you guys send in a ton of great stuff, articles, medical advice, even some personal stories, so I
Wow.
know, there's a lot to unpack here. But the first thing that really jumped out at me, and this was a surprise, was that most of the research actually says that fasting itself, just the act of fasting, isn't like a huge risk factor for kidney stones.
Oh, interesting.
Yeah, like one study even said that people who fasted, regularly had a pretty similar risk to people who didn't fast at all.
That's pretty surprising. I think a lot of people, when they think about fasting, that might be one of the first things that comes to mind. Like, well, is that going to be hard on my kidneys?
Right, exactly. But, it's health, right? There are always nuances.
Always.
Yeah, always. And we do have some sources that have, kind of conflicting views on this that we should definitely dig into.
Okay, yeah, let's talk about that.
But before we go too far down that road, maybe just a super quick recap of how kidney stones actually form in the first place. Just to level set.
Yeah, great idea.
Because I think, understanding that can help us make sense of all these different viewpoints.
Absolutely. So, at its core, kidney stone formation really comes down to the concentration of minerals in your urine.
Makes sense.
Yeah. So if your urine becomes too concentrated, those minerals can start to crystallize and clump together, and that's how those pesky stones are born.
Which, that brings us right to dehydration, right?
Of course, yeah.
Because dehydration is like one of the major risk factors for kidney stones.
Huge.
Right.
Absolutely.
And that's naturally where the worry about fasting comes in, because if you're not taking in fluids, you could become dehydrated.
Right.
And some of these sources, especially the ones talking about Islamic fasting during Ramadan, they really emphasize this concern because people are abstaining from both food and water during daylight hours.
Yes. And those sources are definitely right to highlight the importance of hydration, especially in that context. There's one medical article in here that even recommends aiming for 2 to 3 liters of fluid daily to help counter that dehydration risk.
Wow, that's a lot of water.
It is. But, it depends on the person and their activity level and everything, but yeah.
Yeah, for sure. But it's a good guideline.
Right.
Okay, so we've got the dehydration piece. Now here's where things get really interesting to me. That systematic review you sent, the one that analyzed like a ton of studies,
Oh, yeah.
it basically concluded that most of the research out there, it doesn't really show a strong connection between fasting and like an increased risk of kidney stones, even specifically for Ramadan.
Okay,
But
there's a twist.
I knew there was going to be a but.
There's a twist. 2 of those studies in that review, they actually did find a higher incidence of kidney stones in people who fasted.
Okay, so 2 out of like how many studies was that?
I think it was a pretty good number of studies.
That's still a pretty small number. But what could explain that? Like, what is the difference? Is it the type of fasting? Is it the people in those studies? Maybe their diet when they're not fasting?
Yeah, those are all great questions. And it really highlights that it might not be as simple as just, oh, dehydration equals kidney stones.
Mm-hmm.
And your sources actually back that up. They talk about all these other factors that can play a role in your risk. Diet, for example, that's a big one.
Diet, yeah. Always important.
It is. And specifically things like high intake of oxalates, which you find in some vegetables, and calcium and sodium and sugar, and even animal protein.
Okay, so it's not just what you drink, it's what you eat, too.
Exactly.
Makes sense. And then there are those pre-existing conditions that can increase your risk, too, right?
Right. We're seeing things in these sources like an enlarged prostate or nerve damage that affects your bladder control. Even some medical devices can contribute.
Wow, I didn't realize there were so many different factors.
Yeah, there are a lot.
And then, of course, you can't forget the basics, right? Your family history, your age, even your gender can all play a part.
Absolutely.
So it's definitely more complicated than just saying, fasting causes kidney stones, or fasting doesn't cause kidney stones.
Right.
There's like a whole web of things that we have to consider.
It is a web for sure. It really is.
Yeah.
And dehydration might be like a key string in that web, but it's not the only one.
Right.
It's fascinating how interconnected all these different aspects of our health can be.
For sure. And even though this deep dive is, hyper-focused on kidney stones, some sources did mention some potential benefits of fasting for overall kidney health. Things like reducing your kidneys' workload, helping with blood pressure, even lowering the risk of metabolic syndrome, which can affect your kidneys in the long run.
That's a really important point. Fasting isn't necessarily all bad news for your kidneys, But I think it's key to remember that those benefits you're talking about, those are about general kidney health, not specifically about preventing stones.
Right, good distinction. And we should also acknowledge that fasting is kind of a broad term, isn't it?
Yeah, it is.
Your sources mention Islamic fasting during Ramadan, different types of intermittent fasting, and even some specialized dietary fasts.
Right. So, I mean, there's a huge difference between like abstaining from all food and drink for a month, like during Ramadan,
Yeah.
and doing something like the 168 method, you know, where you fast for 16 hours and then you have an 8-hour window where you can eat and drink normally.
Yeah, that's a big difference.
It is. So the potential risks and benefits, even when we're talking about kidney stones, they could vary a lot depending on what type of fasting you're actually doing.
Right.
I mean, it's a big difference.
It does. Which, I mean, this brings us to a really crucial point. If you're thinking about fasting, especially if you already have a history of kidney stones or any other health conditions, really,
Talk to your doctor first.
talk to your doctor.
Always.
Yes, it's the best way to get personalized advice and make sure you're doing it safely.
Exactly.
Okay, so we've covered a lot of ground already.
We have.
Before we move on, let's do a quick recap of the specific symptoms to watch for if you are fasting and you're concerned about kidney stones.
Oh, yeah.
What are the red flags, the things that should make you, stop and go see a doctor?
Yeah, good idea. Let's
Mhm.
talk about that.
Yeah.
So say you are fasting and you want to, be smart about it. What should you be looking out for?
Well, one of the most common signs of a kidney stone, and it's usually pretty noticeable, is severe kidney pain, especially if it comes on really suddenly.
Oh, yikes.
Yeah, it's often described as like a sharp, cramping pain in your back or side, and it can be really, really intense.
Ouch, that doesn't sound fun at all.
Not fun, no. So that's definitely something to pay attention to. And another one is fever with chills, especially if you have that kidney pain along with it. That could be a sign of an infection, which is, you don't want to mess around with that.
No, definitely not.
Okay, and then keep an eye on your urine too.
Blood in your urine, even if it's just a little bit, that's
If-
another red flag. You want to get that checked out by a doctor right away.
So basically any of those things, pain, fever, blood in your urine, those are all signs to stop fasting and get to a doctor.
Exactly. Don't wait on that.
Better safe than sorry. All right, now let's circle back to those different types of fasting that we were talking about earlier. We talked about Ramadan, where you're abstaining from food and water during daylight hours for a whole month.
Right.
And in that case, staying hydrated during those non-fasting hours is super, super important, right?
It is, yeah. You really don't want to give those minerals any chance to, start crystallizing.
Right. It's all about minimizing that dehydration risk. Now, intermittent fasting, that's usually a lot shorter fasting periods, right? And they happen on a regular cycle.
Yeah, exactly.
Like the 168 method, where you fast for 16 hours and then you have an 8-hour window to eat, that seems a lot more manageable
It does.
than not eating or drinking for a whole month.
Right. And with intermittent fasting, during those eating windows, you're encouraged to drink plenty of fluids. So the risk of dehydration, it might be lower compared to, like prolonged fasting. But of course, it's always a good idea to talk to your doctor before starting any kind of fasting, especially if you've had kidney stones before.
Always good advice.
When you step back and look at everything we've talked about today, I think it's really clear that this whole relationship between fasting and kidney stones, it's more complicated than it seems on the surface.
It is. It's like peeling back the layers of an onion.
Exactly.
You keep finding more and more to think about.
And that's what I love about these deep dives.
Me too.
We're not just skimming the surface here. We're really exploring the nuances.
Yeah, we're going deep.
We are.
So where do we go from here? What are some of the key takeaways that you think our listeners should really walk away with today?
Well, I think the biggest takeaway is that while the research on fasting and kidney stones, it's not totally clear-cut. We know for sure that dehydration is a major risk factor for kidney stones, period, regardless of whether you're fasting or not.
Okay, so hydration, that's key.
Hydration is essential,
Mm-hmm.
especially during those non-fasting periods. Got to keep those fluids up.
Got to stay hydrated.
Yes. Now, here's something that I found really interesting in those research articles. There's a growing interest in the idea that what we eat during those non-fasting periods, that could actually be a bigger factor in kidney stone risk than the actual fasting itself.
Oh, that's interesting. So if you're pounding sugary drinks and processed foods, or even those high oxalate vegetables during your eating window,
Right.
that could be setting you up for trouble, whether you're fasting or not.
Exactly. You can't just out-hydrate a bad diet. if you know what I
I
mean.
do. It's like you're putting in all this effort with the fasting, but then
Right.
you're undoing it with what you're eating.
Yeah. You've got to think holistically. Make choices that support your overall health.
Look at the whole picture.
Yeah.
And I think one of the best choices you can make is to stay informed, which is exactly what our listeners are doing by being here with us on this deep dive.
Absolutely. And that brings us to, I think, a really thought-provoking question. Could there be specific eating patterns that, when combined with fasting, might actually help to minimize kidney stone risk? I think that's a fascinating area for future research.
I love that. Like tailoring fasting recommendations based on someone's individual risk factors, their diet, even their gut microbiome. It'd be like precision medicine for fasting.
Yeah, it's a really interesting concept. It just highlights how much we still don't know about all the intricate ways our bodies respond to fasting.
So much to learn. But until then, I think the key is to be proactive. Talk to your doctor, do your research, and pay attention to your body.
And stay hydrated.
Always.
Yeah.
Now, I know you sent in a personal story about your own experience with fasting. What stands out to you now after we've gone through all this information?
Going through all this research on fasting and kidney stones, it really makes you realize there's a lot more to it than meets the eye.
It does,
It's one of those things that seems pretty straightforward at first, but the more you dig in, the more you find all these, nuances and complexities.
For sure.
And what's really striking to me is how much we still don't know.
Oh, yeah.
I mean, we have, general guidelines about kidney stones, but when you get specific to fasting, there's still a lot of research that needs to be done, especially when you consider all the different ways people fast out there.
That's a great point, yeah.
Like, we know that dehydration increases the risk. That's clear.
Right.
But could some types of fasting actually be less risky than others? I think we need more research to really explore that.
Yeah, definitely.
And then there's that whole interplay between fasting and what we eat when we're not fasting.
Right, right.
Like, could specific eating patterns actually help reduce the risk, even in people who fast regularly?
Yeah.
It's a huge question.
Yeah, it feels like there's a whole world of personalized fasting strategies just waiting to be discovered.
Exactly. Imagine a future where you could get fasting recommendations that are tailored to you, to your individual risk factors, your diet, even your gut microbiome.
Wow, that's amazing.
It'd be like precision medicine, but for fasting.
That would be incredible.
It would be so cool. But, until we get there, I think the most important thing for our listeners is to be proactive.
Totally.
Talk to your doctor, do your own research,
Yeah.
and most importantly, pay attention to your body.
And stay hydrated.
Of course, always stay hydrated.
One of the things I love about these deep dives is that they often leave us with more questions than answers.
That's true.
But in a good way, right?
Oh, absolutely, in a good way.
Because those questions, they're what spark curiosity and drive us to learn more.
They do. They make us dig deeper, think harder, and that's how we really grow.
Well said. And that's what the deep dive is all about. So until next time, keep those minds curious, keep those questions coming, and remember, knowledge is power, but hydration is essential.
Couldn't have said it better myself.